in the community that have been impacted by this pandemic. Today, we're announcing the first of many solutions to provide safe and secure housing for individuals that have tested positive for the COVID-19, are showing symptoms or have been exposed to someone that tested positive for the virus and is still awaiting their own test results. I know that there are many families that, due to their housing environment, cannot self-isolate. If they need to, due to a positive test or are showing symptoms, without members of our community having access to self-quarantine, we are putting others that reside in that home also at risk of contracting the virus. During this time, we need to provide safe and secure housing for those individuals that need to self-isolate for the recommended time frame. This also helps keep our broader community throughout the county safer by mitigating exposure. The Los Angeles County has worked out an agreement that I'm proud to announce with the Sheraton Fairplex Hotel located in Pomona to provide temporary housing and lease 244 rooms for those in the community that need to self-isolate. The lease term is from March 23rd through May 31st of this year, with an option to extend for additional 4 weeks. These rooms will be provided on a first-come, first-served basis, and the county's Office of Emergency Management will assist in housing individuals that need to self-isolate to close proximity to their home. This agreement calls for one person per room, and essential services will be provided to these individuals during their stay, including food, medical care, laundry services, and more. The hotel will have security personnel on site to ensure the health and safety of everyone, including the hotel staff. I want to highlight that this deal will help infuse the local economy of Pomona and the East San Gabriel Valley, keeping workers at the Sheraton Fairplex Hotel employed during a time when our region's travel and tourism industry is suffering the most. This is just the first of many solutions. The county is working expeditiously to add more housing solutions like this across the region in response to this unprecedented pandemic. Additionally, the Fairplex Child Development Center will open its doors to the children of our first responders, including law enforcement and hospital personnel in the neighboring area. The Fairplex is also hosting a drive-through food pantry with the nonprofit Laverne-based food bank Sowing Seeds for Life to support those in the community that need that help right away. At this moment, our communities are reeling from the impacts of this crisis. From health impacts to businesses threatening closure, this is a time for compassion. The individuals that need housing, such as that which the Sheraton Fairplex will provide, that are our neighbors, our friends, our family members, employers, and employees. Let us not give this virus the upper hand by allowing it to harden our hearts and keep us focused inward solely on our own needs. Now is the time for us to rise as a community, support our neighbor, and show compassion. We cannot let fear keep us from caring for those in our community that need it the most. By providing access to safe and secure housing for individuals that need to self-isolate, we're taking the preventive measures to help us flatten the curve and slow the spread of the virus. I would like to thank personally Miguel Santana, the president and CEO of the Pomona Fairplex, as well as his board members, for their unwavering support and partnership, and to Supervisor Barger and the Pomona City Mayor Tim Sandoval for his outstanding leadership during this time. Many of our local elected cities and elected officials and community partners have also shared their support for this move forward. I'd like to thank them. Congresswoman Norma Torres, Congresswoman Napolitano, Congresswoman Judy Chu, State Senator Connie Leyva, Assemblymember Freddie Rodriguez, Assemblymember Chris Holden, the City of Pomona, the City of Claremont, the City of Walnut, the City of West Covina, the City of Laverne, and Pomona Valley Hospital Medical Center, and many, many other community-based partners in the East San Gabriel Valley. I also want to personally thank Marriott International for their partnership and contributions to support our workforce. To this end, with this, I want to urge our community partners and businesses to come forward and consider providing housing for those that need it right away, just as our Sheraton Fairplex Hotel has demonstrated today. We need more supportive housing. We need solutions at this time. And I hope that the Sheraton Fairplex serves as a good example that encourages others to step up and be a part of the solution. I'd like to briefly say something in Spanish. Hola, soy la supervisora Hilda Solís. Yo represento el primer distrito en el condado de Los Ángeles. Hoy vamos a anunciar que estamos tomando medidas para frenar el virus de corona. Queremos ayudar a nuestros amigos, familiares, vecinos quienes tienen el virus. Al mismo tiempo, sabemos que tenemos que separar estas personas para poder proteger nuestras comunidades. De hecho, hoy vamos a anunciar que el Sheraton en el Fairplex en la ciudad de Pomona va a ser el lugar donde vamos a tener personas quienes tienen el virus. Va a ser un lugar con seguridad. En el Sheraton les vamos a ofrecer servicios sociales y también de salud. Este es el momento de apoyar a uno al otro. Las personas quienes tienen el virus pueden ser miembros de nuestras familias. Nos puede afectar a todos a cualquier momento. Nosotros, en amor y con compasión, vamos a seguir en esta lucha contra el virus de corona. Pero para ganar nuestras crisis contra el virus, todos tenemos que mantener 6 pies de distancia entre uno al otro. Con este nuevo arreglo con el Fairplex y el Sheraton, vamos a poder mantener distancia entre personas afectadas por el virus. Y estas personas no van a estar afuera, van a estar solas con doctores quienes les van a ayudar. Necesitamos ahorita sitios en el condado para personas con el virus. Hoy en el Fairplex demuestra su liderazgo. Tengo la esperanza que otros van a seguir también haciendo un ejemplo mejor. En este momento tenemos que ser valientes, tenemos que ser compasivos a nuestros vecinos, amigos, familiares. Este es el día que decimos el condado de Los Ángeles va a triunfar contra el virus de corona. Muchas gracias. Now I would like to thank you, but also say I would like to introduce the President and CEO of the Pomona Fairplex, Miguel Santana.
Good afternoon. I want to start off by thanking Supervisor Solís, Supervisor Barger, and the entire county family for their professionalism and the way they have approached us in doing our part in this effort. Supervisor Solís called me just a few days ago and asked what we could do to be responsive to the crisis. And immediately we came to action and worked closely with the county team to identify a number of ways that our 500-acre campus can be put to good use. These last few days have been particularly trying for our organization, like many small businesses, where we have lost over 30 events and other activities, reducing in a significant reduction of our workforce. So it was important that we still find a way to fulfill our community benefit responsibility, and we are doing so through this effort. As you heard today, effective Monday, the Sheraton Hotel will become available for the county to provide a safe space for those who are experiencing some form related to this virus. So the hotel itself will be closed for the rest of the public all the way through the end of May, and it could possibly be extended out to all of June. In addition to that, our 200-plus child care center will be available for those families who are first responders who need a safe and quality place to have their own children during this time. We've also partnered with a local food bank, Sowing Seeds, to make our parking available for a drive-through food pantry. Beginning on April 1st, we will start allowing Sowing Seeds to have people drive through our campus, pop up their trunks, and volunteers will provide food for those in need. The county may also use other assets that we have on our campus, depending on how this crisis moves forward. We are here to help, to do our part, and we encourage others to do the same. Already we've been talking to philanthropy who's interested in supporting these efforts so that the child care we provide is at low or reduced cost. For information of ways that Fairplex is doing its part, and if you want to pursue similar things in your own community, please visit our website at fairplex.com. Thank you. At this point in time, it is my pleasure to introduce the mayor of the city of Pomona, who's been a partner with us throughout these efforts, Tim Sandoval.
I'm Tim Sandoval, mayor of the city of Pomona. I want to start by thanking our board of supervisors, particularly Supervisor Solis and Supervisor Barger. You are leading by example in this moment of crisis. During ordinary times, a common refrain among cities faced with decisions that are seen to make demands on their city and residents is not in my backyard. Today, we are living through an extraordinary time. During this time of great uncertainty and need, we will be defined by how we treated our most vulnerable neighbors. This unprecedented challenge calls on all to lead by example and lead with compassion. When this is over, because it will be over, and we will emerge stronger, we will be defined by how quickly, how sincerely, and how kindly we responded. The Pomona community is proud to step up. We are here to serve. I'm here today to express my support without reservation for the decision to utilize the Fairplex Pomona to provide care and comfort for those impacted by the COVID-19 virus in this time of crisis. Pomona has always been a community that serves more than itself. Because of that, we are blessed with a number of incredible institutions that provide education, entertainment, and hospitality, as well as care for those in need. Foremost among these are Pomona Valley Hospital and the Fairplex. These are institutions we can always count on in good times and in bad, and the people of Pomona are extremely proud and supportive of their contributions to the well-being of our region. Make no mistake, this crisis requires the communities of Los Angeles County to work together, to care for those who are ill, to support those who provide this care, and to protect the vulnerable from harm. Each community must consider how they can best contribute to this cause. The strategy unveiled here today leverages the very best resources in the county in an effort to combat the virus. The Fairplex will offer world-class facilities to care for children of our first responders and healthcare workers while they serve our community. And the hotel facilities at the Fairplex will provide a safe and secure opportunity to house and care for those who have been directly affected by the virus and need of support. It is with humble pride that I remind everyone here today that Pomona was one of the first cities in the nation to step up and declare ourselves a compassionate community. This wasn't led by elected officials or figureheads. Rather, it was through a grassroots effort led by our amazing residents. In a compassionate community, people are motivated to take responsibility for and care for each other. I can think of no greater act of compassion at this time than to serve our neighbors by opening our institutions to those affected by this virus, be they those who have been exposed or those who are serving and protecting our communities. Indeed, Pomona is ready to serve once again. I know based on the love and compassion I am seeing from our residents and the rest of the residents from the greater Los Angeles region that we will emerge out of this crisis as a better community. We are stronger together. Please stay safe, stay strong, and stay connected. Thank you. And now I'd like to introduce Steve Storbakken, Director of Emergency Preparedness at Pomona Valley Hospital Medical Center.
At Pomona Valley Hospital Medical Center, our top priority is to protect public health, prevent disease, and promote the health and well-being of everyone in our service area. We want to assure the community that our hospital is taking appropriate precautionary actions to ensure that our staff is well prepared and properly equipped to swiftly respond to COVID-19 cases that present at our hospital. We are following all recommendations from the Los Angeles County Department of Public Health and the Federal Centers for Disease Control and Prevention. At this time, we have a limited supply of tests and are only able to test those with symptoms. We do not have drive-through testing at this time. We are postponing some elective surgeries and procedures to free up capacity and personal protective equipment. We do have visitor restrictions in place, and we would ask you to go to our website at pvhc.org for specific information, because that is updated frequently. Thank you. I'd like now to introduce Barbara Ferrer, the Director of Public Health for Los Angeles County.
Good afternoon, and thank you so much, Steve. I also want to thank all of the courageous leaders who were here today. A particular thanks to Supervisor Barger and Supervisor Solis, who have, from the first day we heard about a new virus in China, have insisted that this county do all that we can do to both prepare and take decisive actions to make sure that we can both manage what's before us, but just as importantly, take every step possible to slow down the spread of COVID-19. So I'm here to update you, and I also want to thank our wonderful partners, Mayor Sandoval, Mr. Santana, and Steve from Pomona Valley Hospital. This is a perfect example of a community coming together. All the folks at the Fairplex Sheridan coming up with a solution that's desperately needed, and then executing within their community the ability to in fact offer something that's so desperately needed by many, many people across the county. So I want to applaud everybody in Pomona and everybody who works so hard under the leadership of their mayor and with the support from the Board of Supervisors here to make this possible. It will be hugely important as we go through the weeks ahead to have facilities that can care for people who need to be isolated and or quarantined. Today we're reporting 61 new cases. That means we had 101 new cases reported in the last 48 hours, and the total number of cases for COVID-19 here in LA County is 292. These cases include 12 cases reported by our partners in the city of Long Beach and 2 cases reported by the city of Pasadena. The median age for all of our cases is now about, it's about 47. There are 138 people between the ages of 18 and 65 that were diagnosed as positive with COVID-19. And I'm going to start trying to present this data so that everyone can understand that the risk is spread across everybody who lives here in LA County, and that younger people, while they may have a better outcome if they're healthy, are in fact one of the largest groups of people that we have tested who are positive for COVID-19. And even if you're positive and you have mild illness, you can expose others, and that's something we want to avoid doing. 48 people have been at some point hospitalized, and 3 of our new cases are currently in the hospital. We will continue to try to provide more information around the outcomes for people as time goes by, but obviously there's lots and lots of people that we're following at this point. and it takes a while to collect all of that information. As of March 18th, about 2,400 people in LA County have been tested, and 10% of the people who were tested are positive. You can see an updated report on LA County cases on our website at www.publichealth.lacounty.gov. When we look across what's happening in Europe now and other cities in the United States, particularly New York City, we know that we need to be prepared for many, many new cases. And with many more cases, we must do everything we can to practice social distancing everywhere we are in order to not overwhelm our healthcare system. So I'm proud to be part of a team that's worked together to announce safer at home policies, ways for people to be safe, stay at home safely, and still allow for essential services to occur in our county. And our leaders from the state, from the County Board of Supervisors, and from our cities all came together and committed to this new phase in slowing the spread of COVID-19. Supervisor Catherine Barger, LA City Mayor Eric Garcetti, Long Beach Mayor Robert Garcia, Pasadena Mayor Terry Tornick, all joined last night to announce the new LA County, Pasadena, City of Pasadena, and City of Long Beach health officer orders, and Mayor Garcetti's emergency order. And they're all called Safer at Home. Governor Newsom also announced yesterday evening a statewide order, Stay at Home. And I know it's confusing to see that there have been lots of orders, but I want to be clear that every one of these orders is aligned on the one key message. Everyone who's not an essential worker must stay home and only go out for essential activities. These orders direct the closures of all non-essential business establishments. This includes places like indoor malls and shopping centers, indoor and outdoor playgrounds, except for those in child care centers, and all non-essential retail businesses and other businesses. But let me talk about essential services, because there are many services that we all need in order to be able to survive, and those services will remain open. And that includes grocery stores, supermarkets, certified farmers markets, food banks, convenience stores, and other establishments that are providing food, pet supplies, and cleaning and sanitation products. Food cultivation is allowed. Businesses that provide food, shelter, and services to people in need are open. Media services like yours remain open. Gas stations and auto repair shops remain open. Banks and credit unions are open. Plumbers, electricians, handyman services, funeral home workers, security personnel, and other key maintenance businesses all remain open. Schools and child care all remain open, but they are obligated to adhere to additional requirements for social distancing. Pet caregivers and services for pets are open. Residential and home-based care for seniors, adults, and disabled people are open. Laundromats and dry cleaners. Businesses that support, supply, or deliver essential goods and services. Restaurants are only allowed to be open for carry-out, delivery, or drive-through. Businesses that support telecommuting and working from home. Transportation services, including public transportation and taxis. Businesses that provide parts and services for our essential infrastructure. Professional services, including legal services and accounting services. Military defense contractors, and hotels, motels, and shared rental units. The list of what is open is significant, and it only is able to happen because there are essential workers that will continue coming in and doing their jobs to protect the rest of us. All healthcare facilities are open, and I want to note that LA Unified School District's 60 grab-and-go meal sites are open and remain open. Yesterday, they served over 92,000 meals. We're encouraged that so many of these essential businesses have agreed to implement social distancing as much as possible while they remain open, because it's still important wherever people are that they stay 6 feet apart from each other all of the time. I want to thank everybody who is working in these essential roles. It's very hard to care for yourself, your families, and still do these critically important jobs. You are among the heroes of the efforts to keep our community safe and healthy. You can find the health officer order on our website, the Department of Public Health's website. And I want to just finish by reminding us about universal precautions that everyone needs to take, and thank everyone who's been committed to slowing the spread of the virus and has been practicing all of the social distancing measures we've asked for and adhering to all of the guidance. We're so appreciative, and everything you're doing really counts. Please assume that COVID-19 is widespread, and that even without being tested, you still may be infected, and you still may be around others who are infected. That means that you may expose someone, and you may be exposed to someone. While testing may help identify for people who are symptomatic that in fact their symptoms are caused by COVID-19, and that opens the door to the possibility of certain treatment options, for people who are negative, it only gives you an assurance for one moment in time that you are not in fact exposing others. You can be negative today and positive tomorrow. Given that there is a lot of COVID-19 infections in this country and abroad, it is best to do our daily business assuming at any one given moment in time we need to protect ourselves from infecting others and protect others from and make sure that others are not infecting us. And that means stay home as much as possible. You are safer at home. And it doesn't mean you can't go outside and take a walk or hike or jog, but it does mean no parties, play dates, or trips to the mall. It also asks that when you do need to go to a grocery store or to a pharmacy, you should make sure you adhere to social distancing, but ask your neighbor or your friend or your grandparents or your parents if they need you to pick up groceries or medicines. The less people that are going out to those essential shops and services that are open, the easier it is for social distancing to happen when people are in fact trying to get their food and their medicine. And please continue to wash your hands many, many times every day. A lot of people have asked us questions about what are we doing to make sure that those businesses that have been asked to close are in fact closing. I want to start by thanking all of the businesses that have closed, which is the vast majority of businesses that have been required to close. We do have, and we do appreciate all of the efforts you're taking, and we do acknowledge the enormous financial hardship that this is costing to both the employers and the employees. And you have a debt of gratitude, you're owed a debt of gratitude from all of us. I do want to note, though, that we do have health inspectors that are out and about throughout the entire county and will be going out and about all weekend to make sure that where we find businesses that are not in compliance, we educate them about what the health officer order means and what they're obligated to do. Our experience has been that most people that are staying open are doing it because they are not really sure what these health orders mean for them. And once they're given good information, they are in fact complying. But if you do see someone and you have concerns, I want to let you know that we have a customer call center that you could call, 888-700-9995. The line's open every day from 8 a.m. to 5 p.m. You can also email a complaint at ehmail, one word, ehmail@ph.lacounty.gov. I know that by working together, and staying strong with each other, providing support where support's needed, we are in fact going to be able to survive and slow the spread of COVID-19. And I want you to know that all of us working at the Public Health Department are so grateful for the support from all the other county departments, but also from all the support you've given us. This is a really trying time, a very stressful time, and in many ways a very confusing time. But we applaud everyone who's doing their part, and we depend on everyone to do their part. Thank you so much. And now I want to introduce Kevin McGowan, the Director of the Office of Emergency Management.
Thank you, Dr. Ferrer. So today I wanted to take a few moments to spend some time talking about our continued effort to support our residents and the public within the County of Los Angeles. We continue to have our main efforts focused on building supportive housing and capacity, and today is a great demonstration of what the public-private partnerships and our community partnerships that have enabled responses that 3 weeks ago we would never even have imagined. Continuing to build upon this network is going to be a county-wide endeavor. So today we've showcased an opportunity for one geographical location throughout our county, but to ensure that we can provide capacity and care throughout our entire county, we're looking at geographical locations to best support the public. We've currently begun operations with RVs at Dockweiler State Beach, and we also have hotels and services that we're ramping up throughout the rest of our districts. I think it's important to note that we're asking the community to respect the individuals' privacies that are going to be using these facilities. This is a very stressful time for the people who are going to be in quarantine and isolation, and I ask you all to respect the opportunity for them to do that in privacy. As it relates to Dockweiler and the Pomona Fairgrounds, the Fairplex, this is accessed through our healthcare service providers, and so we're also asking people not to show up at those locations seeking assistance. You should seek your assistance through healthcare providers, and that those healthcare providers have a system in how we're providing supportive housing. And lastly, I want to encourage everyone to continue to engage this emergency through the lens of humanitarian efforts and communities supporting communities. And with that, we'll be able to get through this together. Alan, that concludes my remarks, and we're ready to take questions.
Alan, are you available? Okay, with that, does anyone have any additional Spanish remarks that they would like to provide at this time? We'll move on to Spanish remarks now.
Buenas tardes, mi nombre es Miguel Santana, soy el presidente de Fairplex en la ciudad de Pomona. Voy a empezar a dar las gracias al Condado de Los Ángeles, a Supervisora Solís, por trabajar con nosotros para poner en parte nuestra solución durante este tiempo de crisis. Empezando el lunes, el hotel en Sheraton Fairplex va a estar disponible al Departamento de Salud del Condado de Los Ángeles para esas personas infectadas en este virus. Esta solución va a ser parte de una solución en todo el condado, empezando el lunes y terminando el fin de mayo. Puede ser que vamos a seguir adelante en todo el mes de junio, todavía no sabemos. Además de eso, también vamos a poner nuestro Child Care Center para todas las personas que están en parte tratando de ayudar a esa gente que lo necesita más que nada ahora. Empezando el 1 de abril, también en Fairplex vamos a tener la oportunidad para esas personas que necesitan comida gratis, que vengan a nuestro estacionamiento a recibir comida para ellos y sus familias. Estamos aquí a ser parte de la solución, a ayudar a toda la gente del condado de Los Ángeles. Si buscan más información en términos de en qué parte vamos a hacer este esfuerzo, vayan a fairplex.com. Muchísimas gracias.
Buenas tardes a todos y muchas gracias a todos los líderes que están con nosotros hoy y por la fuerza de su trabajo. Nosotros aquí estamos seguros que sí vamos a parar el movimiento de fuerza que tiene este virus en nuestra comunidad. Hoy estamos reportando 61 nuevos casos de COVID-19. El número total de casos en el condado de Los Ángeles ahora es 292. Tenemos 48 casos que han sido en algún momento hospitalizados. Eso incluye 3 personas nuevas en este número que estamos anunciando hoy. Todos los casos confirmados están siendo aislados y los contactos cercanos están en cuarentena. Hasta el 18 de marzo, aproximadamente 2,400 personas se habían sometido a pruebas en el condado de Los Ángeles y 10% de estas personas dijeron positivos. Puede ver el informe actualizado en los casos del condado de Los Ángeles en el sitio web del Departamento de Salud, en Public Health, una palabra, lacounty.gov. Lo voy a decir de nuevo, Public Health, una palabra, lacounty, una palabra, .gov. Cuando observamos en Europa y en otras ciudades en los Estados Unidos, sabemos que debemos estar preparados para muchos más casos. Y con muchos más casos debemos hacer todo lo que es posible para practicar el distanciamiento social donde sea que estamos. Pedimos hoy que ustedes están en acuerdo con nosotros y que todos aquí estamos para la seguridad de la comunidad entera. Muchas gracias. Estamos abiertos para preguntas.
I apologize. We are having some technical difficulties with reporters being able to ask their questions through the teleconference. For all reporters, if you could submit your questions in the Facebook comments, we'll be monitoring them to take a couple of questions. So please go ahead and submit your questions on the Facebook comments, identifying your media agency. In the meantime, we do have one question that came in from a reporter. It says, Barbara said that there was going to be an update on the drive-through testing today. Given how limited the testing remains, are they making decisions based on worst-case scenarios?
Thanks, and that's a great question. As you know, Dr. Kazan, who's the medical director for LA County's fire department, has offered his services to help explore all of the issues related to lab testing across the county, and we're so grateful for his service and his willingness to take on this mammoth task. Obviously, it involves way more than the public health lab services, and he is still pulling together information on the other places that have opened up drive-through capacity. At the public health department, we've tested in 3 of our locations the ability for us to stand up a drive-up capacity. We're going to need to use this, so I really appreciate this question, as soon as we see a lot more outbreaks in institutions. So our worry now is that in institutional settings, you could have as many as 30 or 40 people that would all need to be tested and tested rapidly. Those are all people who may be symptomatic, and those are all people who may be very vulnerable, not only for illness themselves, but actually for exposing others. So one of the things that we're testing now is what the throughput would be at our public health drive-through stations, so that we could manage lots more testing needs for, again, those people who are symptomatic, and we absolutely need to get a handle on what could be an outbreak, a significantly large outbreak amongst an institutional setting or amongst first responders or amongst other healthcare workers. These are the places where getting test results quickly becomes paramount, and that means getting people tested quickly. I do want to note that, because I think, Claudia, under this was a bigger question of, where do we see this headed in California, and particularly in LA County? Like, what are we projecting might be situations we should be preparing for? So, New York City, which has about 8 million people, reported 2,000 new cases in one day. My team is preparing for managing a situation where we too might see 2,000 cases in one day. If in those situations you do tend to have a lot of clustering, and where clustering is happening in vulnerable institutional settings, we too need to be prepared to rapidly be able to test those people. And I know we're all interested in improving testing capacity, but the biggest need for us around testing capacity is going to be making sure we get to those people who are symptomatic, and particularly those people who are symptomatic and very ill, because they'll need to be enrolled in clinical trials in order to have access to all of the new possible treatments that are available. I know that Dr. Kazan is going to continue to report out to all of you what he finds and what the ability is for this county to stand up more commercial lab capacity. But I want to be clear that from the public health perspective, we will always have to prioritize making sure that there's testing is accessible to those who need it the most. Thanks for that question.
Thank you. And the next question is, has the county received the appropriate funding from the CDC in order to address this situation?
Yes, I'm pleased to announce that we received, I think it's $19.5 million as an extension of one of our CDC preparedness grants. And we've been authorized, even pending all of the paperwork being completed, to begin to be able to use that money to support all of the public health activities. There are other sources of funding that are going to also come into the county. This grant is very specific to surveillance, contact tracing, case identification, communication to the public about public health issues and COVID-19, organizing and training healthcare workers and providing guidance to all the different sectors. But I wonder if Kevin McGowan wants to come up and just talk about other sources of federal funding that may become available for all of the other efforts that the county is engaged in.
Hello. So when the president declared an emergency, and then in addition to that, through state action, there are multitudes of funding sources that become available. And when the Los Angeles County Board of Supervisors also proclaimed a local emergency, it triggers actions that then provide pathways for us to seek reimbursement. Those reimbursements are similar to what we receive when we have natural disasters and other kinds of emergencies.
Thank you. The next question is, has there been any cases identified among the homeless population or the inmate population?
To date, we don't have confirmation on any positives, either amongst people experiencing homelessness or people who are incarcerated in our jails. But I do want to caution everyone, we are doing investigations of both people experiencing homelessness, they're being tested, and people who are in our jails. And it really is just a matter of time before there will be positive cases in both of those settings. That's what I meant when I said there is a lot of community spread. We will start to see cases pretty much everywhere in all of our communities, which is why it's so essential that we do as much as we can to reduce our exposure and to exposing others.
The next question is, who is the lead county agency that is responsible for addressing the homeless situation among the COVID-19 virus?
The way we approach our homeless challenges, even prior to the pandemic occurring, is through a tightly knitted group of organizations. And from the county, it's our homeless initiative organization that resides within the Chief Executive Officer's office. We continue to leverage all of our partnerships within the framework of how we address homelessness throughout the county. And we're leveraging all of these partnerships in a structured approach that coordinates with the city emergency operations centers and the county emergency operations center.
The next question is, how long do you believe that this crisis will have an impact on the public? Can you give us a timeline?
Yeah, thanks so much for that question. I don't have a definitive answer. What I do know is, again, based on what we're seeing in other parts of the world and now in other parts of our country, is that this is going to last at least 4 to 8 more weeks. And I would suggest that people be prepared for it to go on for much longer. It's not that we know for certain that it will go on for much longer, but the name of the game right now is preparedness. The more we can be prepared for what may be a significant restriction on what we do with each other, and particularly what we do with each other in large groups, I think the better we're going to be able to handle whatever comes. What I do know is that where social distancing has been done and done well, and where the public health departments have been able to maintain the ability to identify people who are positive and isolate them and quarantine their very close contacts, they've had success in both slowing the spread, but also in diminishing the number of people who are, at the end of the day, infected. And that's what I ask all of you to do. Be prepared for this to be a long haul, but do everything we can right now to slow the spread and to reduce the number of people who can be infected.
And the last question that we'll be taking is, why would someone be denied testing if they are showing all of the symptoms? Can you break down the criteria and say who ultimately signs off on who is approved to be tested?
Thanks, and I appreciate the question, and I know that you're asking a question that so many people are asking in our communities. So the criteria right now for testing still involves having a provider issue a lab order for someone to get tested. And that means that the decision on who gets tested rests with a provider, a clinical provider, a medical provider. So if you're a person who's showing symptoms, you do need to talk to your provider and have your provider authorize a test for you for COVID-19 by issuing that order. And then once that happens, your provider will work with you and help you find a place where you can have a specimen collected if it can't be done in your office, and then have that specimen tested to one of the many labs, many commercial labs that are here in LA County. If you're a patient in a hospital and it's determined that you need the test, you'll have that done while you're in the hospital. But don't go to a hospital to get tested. That doesn't work. You need to call your provider and have your provider review with you what your clinical symptoms are and determine with your provider what's the next appropriate action for you to take. And with that, I want to thank everyone for being with us today. We appreciate all of the attention you've been paying to this issue, but most importantly, the accurate information that you're getting out to the viewers, listeners, and readers. So thanks again.